Dr. Paul here. I've got a little baby that has some frequent bowel movements, I believe. Let's go take a look. Hello. Hi. How you guys doing?
Good. Just a little bit.
Pooping every hour? Oh my goodness. And you got the hiccups. How long has this been going on for?
We're on day 13.
Day 13 and pooping every hour? Oh my goodness. Is she breastfed?
She's breastfeeding, yeah.
And does she eat other things?
When I started thinking about it could potentially be food, I stopped for the week. So it's been about 6 days since she's had any food and just breastfed.
Well, until we know different, when you go back to feeding, I would go to just vegetables.
Okay.
Just in case.
Well, I'm telling you, this kid is not like her brother. Her brother ate everything.
Yeah.
She just won't eat.
You're picky, huh? Will she hold on to things?
Oh, yeah.
Yeah.
Oh, yeah.
Okay. Obviously, when you have a change in bowel movements, you've got to always think about the diet. What's going in might be affecting what's coming out.
Right.
The other thing is, so with the frequent stool, what does it look like?
So I brought an example of a diaper here.
So this is greenish and a little bit slimy, mucusy kind of. And then prior to this one, it's been mostly just greenish, I understand?
Yeah, exactly. And it seemed more like just her normal poop, just more frequent.
More frequent. Okay. Hi. Hi.
You got some hiccups, huh?
Your heart sounds great. I could hear lung sounds too.
4 days ago, she started like some nasal congestion.
Okay.
Green boogers.
Sorry about that. Ears are perfect. Let's take a feel for that tummy. Whee! There we go.
The reason I also finally brought her in is her skin breakdown. Her bottom is awful.
Is it? So she's had a bad diaper rash?
Yes.
Oh dear, okay. So we've got a red bottom here in the creases. And actually when I have mucusy or bloody stools, I'm interested in seeing if there's any tears perianally. And I don't really see any tears, but it is irritated. When it was red all around the anal area, and if you have sparing of the creases, so here's her creases, you see that in the thighs? It's a little bit spared right in the middle.
What do you mean by spared?
No rash.
Okay.
Right in the middle of the crease. If it's yeast, you'll have worst right in the crease.
Okay.
Because yeast likes warm, moist.
Sure.
So I think this is more of an irritant
I do too.
rash, and so any good barrier like that is going to help it.
Yeah.
I think that's what's going on with your rash. We're going to keep it protected with a barrier cream, and I like the white stuff. Yeah, the white stuff works pretty good. You can't even get it off your hands because it's so sticky, and that's a good thing. Yep, you got the cutest hiccups. You got the cutest hiccups. All right, we're going to go take a look at that bowel movement and test it for blood. All right, I'll be right back. All right. So this is called a MUCUS test. Take a little sample of this stool and rub it on these little test squares. And then you close that side, put the reagent, a few drops on each, a couple drops, and then in the control panel. You'll see here, this is blood. We'll look, that's the control. It's a positive when it's blue. And this is not really turning blue. The discoloration there is just the poop itself. Got a little bit of mucus, but it's not bloody, so that's a good thing. So this MUCUS test only takes a few seconds to react, and it's something you can do in the office, or like I said, some doctors will send you home with the cards if they're worried about chronic recurrent bleeding from the GI tract. So there's no blood, so that's a good thing. Because you're still breastfeeding, has anything changed in your diet? Nothing at all?
No.
Well, that's interesting. That's really interesting. That's funny, huh?
He's kind of funny,
That's funny. You are too cute. So there's one other piece of history here. Your cousins who see me had strep. Yes, they did. They had strep. So it's very, very unlikely that a baby under a year of age would have strep.
Oh, okay.
But given that there was a lot of exposure and kids this age are sticking everything in their mouth, we're going to take a look. It's really hard to see babies' throats.
I got it.
You got it?
I did.
Okay, and then we'll just take a quick swab. I know, I do. Ha 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 ha. Got it. All done. We'll let you know in 10 minutes what this is.
Okay.
Yeah. Breastfed babies' stools, for the viewers, can be as infrequent as once every 2 weeks and as frequent as 10 or 12 a day.
You know, like I said, Monday and Tuesday she went to school,
Yeah,
and then
it started
Wednesday on.
Okay.
So I'm like, I'm just thinking it's a little bug.
It probably, given that story, is rotavirus. It's the #1 cause of vomiting and diarrhea, but you haven't vomited. You know, you don't always get vomiting with rotavirus, and it's not the only virus that can cause loose stool.
Okay.
So if that's true, she should be getting better in the next few days, hopefully.
Okay. All right.
And so let's just sit tight, and then when you reintroduce solids, let's stay away from the grains.
Okay.
And just stick
Fair
with
enough.
vegetables,
Sure.
and let's see what happens.
Okay.
All right?
We'll do it.
Okay, well, thank you so much. That was her comment to the viewers. She said, now you guys know. Is that right? Now they know? Yeah. Okay.
You're so fun.
Thanks for watching. I'm Dr. Paul. Cutest baby ever.
Aw, thank you
I
very
think you're
much.
going to get the cute baby award.